Welcome to another episode of the Miko Peled podcast. This episode isn't just an interview. It's an urgent call to action for material support for Palestinians facing the threat of the coronavirus. Palestinians are one of the most at-risk populations as they face this pandemic, with a lack of adequate health resources in very dense urban environments that are controlled largely by Israel. Since COVID-19 became a global reality, the Palestine Children's Relief Fund, a nonprofit and humanitarian assistance organization, has been working on the ground in the West Bank, Gaza Strip, as well as Lebanon and Jordan's refugee camps to help support the public health care system and response by providing equipment and materials. Steve Sosebee is the founder of the Palestine Children's Relief Fund, or PCRF, and worked as a journalist in the West Bank for the Washington Report on Middle East Affairs in 1988. PCRF got its start after Steve learned of a Palestinian boy who lost both of his legs, an eye, and a hand. He coordinated care for the boy and his sister in the U.S., but then began helping other children. The Palestine Children's Relief Fund then formed in 1991 and has been providing life-saving critical relief to Palestinian children ever since. In this episode, Miko touches base with Steve, who is currently on the ground in the West Bank amidst this virus, and they discuss the current situation, infection rates, what relief looks like, and what all of us can do to pitch in to support PCRF's current COVID-19 Humanitarian Response Fund for Palestine, which you can actually donate to right now by going to www.pcrf.net. We urge all of our listeners to pitch in what you can to this campaign. Share it with your family, share it with your friends. Try and spread the word and maximize the amount of medical supplies and aid resources that PCRF can deliver to the people of historic Palestine, the people who really need us to step up right now in this moment. Now on to the conversation between Miko Peled and Steve Sosebee.
Who is the founder and the CEO, I guess, of Palestine Children Relief Fund, PCRF, a wonderful relief organization that has been doing tremendous work for a very long time with Palestinians, with relief for Palestinian and particularly Palestinian children. Steve and I have known each other, been friends for a long time, and it's really great to be able to chat with you here today. So maybe you could just kind of tell us how you're doing and maybe a little bit about PCRF.
Sure. Thank you, Miko. First of all, thank you for having me, and I just want to say how much I appreciate and respect you, not only for the work you're doing, but for the moral and ethical positions you take on this very important issue. For a long time, I know it's sometimes you're by yourself from the Israeli side, or it seems to be that case. I know that's not actually the case, but I just want to give you a particular mention of respect and appreciation for who you are and what you stand for.
Thank you.
And and also to everybody listening, just to stay safe and keep your humanity, and remember that these times of crisis is when we present who we really are as people and as human beings. And if you're somebody who believes in solidarity and equality and freedom and justice, now's the time more than ever to stand on those principles and present that to the world. Here in Palestine, where I've been living for many years, the situation, as you've asked about, is kind of a tenuous one, meaning that the main focus for all relief organizations, as well as the government here, the Palestinian Authority, is prevention. Because once this coronavirus, this COVID-19 pandemic breaks out here in the occupied territories, there's no stopping it. They don't have the resources, they don't have the infrastructure in the health sector to really do much to stop it once it breaks out. So all of the focus now is to really prevent the spread from coming. And as you can imagine, that's quite a challenge, considering that the occupation in the West Bank in particular by the Israeli government, the Israeli military, settlements all around. The infection rate in Israel is much higher. It's comparable to what it is in the United States. I believe there's over 7,000 cases in Israel with a population of just under 10 million. So here in the West Bank, we only have around 230 cases so far recorded, and the vast majority of them in the past couple of weeks have come from workers returning from Israel, the laborers who do much of the manual menial tasks there inside Israel, coming back to their families with infections of COVID-19. And the outbreak happened about 6 weeks ago in Bethlehem with tourists who were coming from, I think, Greece or somewhere in Europe, and brought the infection into the Palestinian territories. And I have to say, the Palestinian Authority did a very good job. They were aware of how serious this issue was early on, much more than my own government back in the United States, and took very drastic measures at the time to, first of all, shut down Bethlehem, which was, right around Easter time, right before Easter, is the main source of income for the Palestinian economy. So it was not an easy decision to make, but they took that decision. And then as the infection started to spread through the territories, they started to shut down the entire West Bank. And now we have been here, the schools have been closed for about a month now, as well as for the last few weeks, the restaurants and all of the businesses. And for the most part, people are living under quarantine. In the Gaza Strip, we have, I believe, somewhere between around a dozen cases, and most of them were coming back from Egypt as Palestinians who were either traveling in Europe or in other parts of the world, bringing the infections back. And obviously, Gaza is a much more serious challenge because of the even more lack of resources in the health sector there, due to the embargo and the sanctions that have been imposed on the Gaza Strip since 2006. So the health sector has been under siege and has been, near collapse for many years. That's an area that we work very closely with the people there, serving the population, and know very well how dire that health situation is. In Gaza, it's the risk is much higher because the density of the population is extremely high. In addition to, you have 8 refugee camps in Gaza. These camps are congested. People live on top of each other in immense poverty, open sewage. And in addition to that, the level of hygiene in Gaza is impacted by the very poor quality of water. 90% of Gaza's water is undrinkable. So you can imagine how that affects the ability to wash hands and stay clean, and the hygiene factor, which is so essential in fighting this disease and this virus and the spread, and all of the other factors that go into this overall prevention mode that the Palestinians have to take at this time. So
what do they do for prevention in Gaza, for example, with the conditions being as they are? How do they prevent the spread of the disease?
Well, it's ironic in a kind of a cruel way. As I mentioned, Gaza, and you know this very well, has been under siege for so long. It's been closed completely by the Israeli authorities since 2006, and the border with Egypt has been only open occasionally, meaning that the Gaza population in some way benefits from this isolation that the rest of the world is unable to kind of get under control. The fact that people in Gaza don't travel outside, don't have permits to travel outside easily, don't have access to the world. People cannot go into Gaza very easily. This has given them a slight advantage, or maybe not even a slight one, compared to the rest of the world when it comes to controlling the infection. So there's basically 2 points of entry into Gaza for people who are coming from the outside. There's the Rafah border crossing with Egypt, which I mentioned, and there's the Erez crossing with Israel. And both of those borders, when you cross into Gaza, are controlled eventually by the Palestinian Authority on the ground there. And when people come in, they can be cordoned off and quarantined immediately, rather than going to their homes and asking them to self-quarantine. And that's what has been happening. The Palestinian Authority, the Palestinian regime in Gaza, has been quarantining everybody who's been entering into Gaza from both sides, from the north and from the south. And the first group of quarantined persons was just, I don't want to say released, but able to go back to their families yesterday, after spending weeks inside the schools there and some of the other facilities that were set up for them, after they obviously were tested and able to pass home or not show any symptoms. So This is actually an advantage, as I mentioned, in giving them the ability to keep this infection under control. And if they don't do that, if they don't take these very drastic measures, then the risk of the entire Gaza Strip being infected rather quickly would be an extremely serious humanitarian crisis.
And you were saying that in the West Bank, restaurants, schools, businesses are all closed?
Yeah, everything's closed. The only thing that's been open so far are supermarkets and pharmacies. And what we understand from the word that came out today, the unofficial word, but everybody's talking about it, that they're planning to even make it even more kind of harsh, meaning that even those facilities will be closed. Because if you go out into Ramallah, I went out today just to kind of go around and see what was happening, not to meet anyone or see anybody, but there's still some people out. And that's not to say that there's widespread traffic. There isn't. The streets are for the most part empty, but you still see people. But people have been very good about adhering to the law and adhering to the closure that has been enacted by the Prime Minister's office. But with that being said, I think they're quite concerned.
So how do people make ends meet? What do people do for livelihoods and sell?
Well, that's the second issue that I wanted to discuss. First, we have the big crisis of the healthcare system here not having the resources to deal with a widespread outbreak, and the determination of the Palestinians to really prevent the disease from taking root in the occupied territories. That's the main focus, obviously, from a medical point of view. But the other aspect of this virus here in Palestine, the spread of COVID-19, and this is true everywhere in the world, but it's especially true in underdeveloped and poor countries like Palestine, is the economic impact of the closure and the social distancing and the quarantine that the societies have to go under. A significant population of Palestinians live day to day. They're laborers, they have small businesses, they depend on that daily income to feed and take care of their families. And there isn't a social network here where the government can pass a $2 trillion or any amount of relief to give people cash at this time to alleviate some of the hardship of feeding their families and taking care of the basic costs. Now, the society here does have a pretty strong charitable component where families and people try to take care of each other. And that's been true for the Palestinians for a long time. If you are Palestinian or you know Palestinians, you can always ask about the one breadwinner who educates his brothers and sisters after he gets educated and shares the wealth and shares the opportunity. And that's true here on the ground as well. When people go without, others try to share. Now, we've been under curfew many times here. I can remember the 6-week curfew during the first Gulf War when the entire West Bank was locked down by the Israeli military. That's not the same thing as what's happening today. But Palestinians have gone through this kind of circumstances in the past, and maybe that's why we don't see the same scenes of panic or I don't know what you're calling it in the U.S. Is it panic shopping or what people are doing when they kind of go into these supermarkets and purchase large quantities of things that you wonder why they're purchasing. We don't see that here in Palestine. People are not panicking and they're not exhibiting any kind of general social disorder behaviors that we see in the US or in other kind of developed countries. And I think a lot of that has to do with the fact that they've gone through some of these circumstances in the past with living under occupation.
Have you been out of Ramallah? Have you seen what's happening like in some of the smaller towns and villages or other cities?
Yeah, last week I went to Tulkarm, Jenin, and Nablus. And I have a permit from the Ministry of Health that enables me to travel. I'm not doing that, just as a kind of disrespectful way. I have responsibilities to, and we as an organization have responsibilities here on the ground to do relief projects and to help alleviate some of the suffering that we're seeing here every day. So I did go to Tulkarm, Jenin, and Nablus, and I would say I was stopped by maybe 12 to 15 different Palestinian checkpoints where they were kind of ensuring that people were not just going around and trying to contain traffic and limit people from moving. In one checkpoint, when I entered Nablus, they even took my temperature with one of the small kind of handheld devices to ensure that I was not symptomatic. And I respect that. And I was kind of, it gives people a sense of confidence. I'm not sure exactly how effective it might ultimately be, but it does give a sense of confidence that the government is trying to limit movement and control the spread in whatever measures they have available. So, and going into those places like Tulkarm and Jenin and Nablus, three of the main towns in the northern West Bank, Nablus in particular being the main economic hub of the northern West Bank and the West Bank itself, you see very limited economic activity. You see a limited number of people in the streets. All the businesses are closed. And, again, that's a sign that the Palestinians are taking this very seriously and doing their best to prevent this virus from spreading.
As you drive into Nablus, there's this whole street that first of all is full of restaurants, then it's full of furniture stores, then there's all these, so everything is closed.
Everything. They're
Wow.
they're not allowed to be open. Here in Ramallah, even people who work by themselves, there's a carpenter we met who hasn't worked in 2 weeks, and he's a guy who also lives hand to mouth and has to make his money every day through his labor. He can't even open his shop by himself to create bookshelves or chairs or tables or things that carpenters here make. People are just not permitted to do anything.
Wow.
And the effect that that's going to have here could potentially be catastrophic from an economic point of view. But it's hard to really speak too strongly on those terms because that's everywhere. That's happening in the United States. That's happening in a lot of countries where the entire economic infrastructure is shut down at the moment.
So tell me a little bit about what PCRF is doing right now. What are you guys doing?
Thank you for asking. We're first of all, we're also working in Jordan and Lebanon. The refugee camps in Lebanon are their own kind of hotbed of potential outbreaks, given the density of the population there and the lack of governmental support for prevention and services. And that's a different story. We could talk on that a bit if you'd like. But overall, and we have offices and field workers in all of those countries, Lebanon, Jordan, and the West Bank and Gaza. And our goal is to identify at-risk populations and to provide some form of support and assistance. And in particular, the two main areas that people currently need support are infection control materials and supplies that enable them to keep clean and keep their relatives and their family and their living environments free of the disease, and also basic foodstuffs, because right now we are seeing significant shortages of food among people who, as I mentioned before, are living day to day. In addition to that, we've provided medical supplies and medical materials for some of the hospitals and doctors that we work with, in particular, the cancer departments that we opened in Gaza for children and the one we opened in Beit Jala have both been provided with some masks and other medical supplies. And we're looking to purchase more PPEs for those medical professionals because they are the ones most at risk. In particular, those kids in those departments with cancer are the most vulnerable because when you are undertaking chemotherapy, your immune system is not able to fight off even the common cold, let alone a virus as dangerous and as aggressive as the COVID-19 virus. In addition to that, we had a campaign last week to purchase digital mobile X-ray machines for the Ministry of Health to help enable them to better identify and support patient care, patient diagnosis, and patient treatment. As you know, the COVID-19 virus is a respiratory infection, and the shortages of X-ray machines within the Ministry of Health makes it more challenging and difficult for better management and diagnosis of people with this disease. So we are in the process of purchasing these items for them. The biggest problem that we're facing, and this is a global problem, is the global shortage of essential items like ventilators, like PPEs, the protective gear for health professionals, face masks, the most basic essential supplies that are most in need are just not available for purchase. There's just a global shortage of them, and that puts us all in a very difficult situation. The rich countries obviously can pay the most for them and can purchase them on the market, where countries like Palestine or poorer countries or less developed countries in this region simply don't have the resources and are far behind the rest of the world in being able to obtain them. So unfortunately, unless the virus spreads and then there's a significant reduction in places like China, bringing over ventilators from China to Palestine might be an alternative to helping to fight the disease here. And I know the Chinese are sending over, or were to send a jet over, full of supplies to the Middle East relatively soon. And hopefully there will be ventilators on that flight, because that's really the most essential item that's in short supply here. And so those are the things we're doing. In addition, we are building and expanding the intensive care unit in the Jenin Hospital. In Ramallah Hospital, we're building a brand new intensive care unit. And in Gaza, we're supplying the intensive care unit with basic essential materials to help supply and enable them to be able to treat patients who may be coming in for intensive care treatment to fight this disease. We're part of a WHO, World Health Organization consortium of NGOs who are all trying to share our information and resources to kind of have a collective response rather than everybody doing their own thing and duplicating the same work or not addressing the most essential needs together. So there is a collective effort being done here by organizations like PCRF and others to work together and to support as much as we can the Ministry of Health and the main health providers on the ground who are at the front line of fighting this disease. But again, limited resources, limited supply on a global market, and places like Gaza, that have been cut off for so long. It's really hard to work in some of those places and get supplies and materials in a timely manner, given the political situation on the ground here.
Do you have any information about what is happening in the prisons where so many Israeli prisons where so many Palestinians are being held? What the conditions are, what is happening?
Yeah, there's been some reports by both Israeli and Palestinian human rights groups that there have been cases of COVID-19 in the Palestinian prisons, in the Israeli prisons where Palestinian political prisoners are being held. And this is not surprising, given that these prisons are generally very crowded. Services there are very poor as far as space and the social distancing when you have multiple people sharing a cell and not having access to basic hygiene and basic supplies of infection control. You can imagine that it's fertile ground for a virus like COVID-19 to take root and to really do significant damage. And we've heard that several Palestinian prisoners have been infected. In addition, family members are not able to visit their relatives any longer. That's been halted since the pandemic began. But getting accurate information right now is very, very difficult because of the closure of the territories, the inability for relatives and family members to have access to their loved ones who are inside prisons, and the bigger crisis that Israel's facing next door with having such a huge outbreak and their own challenges of being able to manage and mitigate the pandemic.
Yeah. So how can people help? People want to do something. What can they do?
No, thank you for asking. We are always looking for donations to be able to purchase materials here on the ground in the local market to be able to provide to poor people, whether it's food, whether it's infection control and hygiene kits for the poorest and most neglected people here, or medical equipment and medical supplies to help boost up and support the collective response to the potential spread, particularly in Gaza. And also in the camps in Lebanon and Jordan, as I mentioned before, where hundreds of thousands of Palestinians don't have a Ministry of Health to protect them, don't have any type of local authority other than whatever the people in the camp can put together and organize themselves. We're on the ground there trying our best to provide support and assistance for those people. So if you visit our website, pcrf.net, and you'll be able to see some of the success stories we've had over the past couple of weeks in dealing with this crisis, and also support our humanitarian work and ensure that 100% of your donation goes towards providing medical equipment, medical supplies, food, and humanitarian materials for individuals, for hospitals, and for healthcare providers.
You mentioned the camps in Lebanon and Jordan. Do you have any data about what the conditions are in terms of the spread of the virus?
Not well. It's very hard. I mean, first of all, in Lebanon, the crisis in Lebanon began several months ago. Not the COVID crisis, but the political crisis there, and our ability to operate and work there was impacted by the uprising of the Lebanese people against their government back in October, which closed roads and closed businesses and just put the whole country in kind of a state of upheaval. And so the accuracy of information that's coming in from Lebanon and from Jordan's much better, much more stable environment, and the government's much more in control, obviously. But in the camps in Lebanon, right now, the access to the camps is under the control of the Palestinians. In 1968, I believe, the PLO, the Lebanese government, signed the Cairo Agreement, which gave the control of those Palestinian camps in Lebanon to the PLO. The internal control, meaning security and services within the camps, is not the responsibility of the Lebanese government, it's the responsibility of the Palestinians. So the Palestinians have taken it upon themselves to set up popular committees to organize access inside the camps, to enforce and control quarantine policies and the closure of businesses to prevent the spread. And so far, it's been relatively successful, but they also have limited resources. So we're trying to support in all of the camps in Lebanon and in Jordan, but Jordan's much more difficult because the curfew there is much more strict. But in Lebanon, we're trying to support these popular committees by giving them materials and supplies and resources to better enact these infection control policies and measures for the people inside the camps.
Wow, incredible! I was in Jordan I just came back from Palestine and Jordan just when this thing was starting at the beginning of March, and I was at the Jarish camp up in northern Jordan, and I understand everything is closed now. People can't travel, can't go in and out, but you can't imagine what might happen if that thing spreads. It would be like wildfire.
Yeah, all of the Palestinian camps in the Middle East in particular are very densely congested. They suffer from extreme poverty, and the infrastructure in the camps make it extremely difficult to stay infection control. I mean, to enact infection control measures. You have in some camps open sewage. You don't have clean water. You have 6, 7 people living in the same room. You don't have space for people to be isolated. Once one person is infected, it will spread very quickly to these camps. So that's a very big worry for the health authorities and for the political authorities in all of these countries here. You can imagine how terrified they are, and we've seen that. We've seen that in Jordan because the measures they took to shut that country down were were very strong, but also very necessary because the risk of an outbreak in Jordan or anywhere in this region, but Jordan in particular, because the government there has the ability to really enforce these rules. The outbreak for them is a huge, huge potential risk, particularly with the Syrian refugees and the Palestinian refugees. So yeah, in Jarish, in those places, which you know very well, it doesn't take much. It's just lighting a match, and it will spread like wildfire. So that's the biggest fear all of us have in this region, and we're praying every day that the workers coming back from Israel into the West Bank for Passover, no longer needed during the holidays in Israel. We're seeing a large number of people with infections. They're immediately being identified and quarantined, and hopefully that will prevent a larger spread that we've seen just across the wall in Israel, which is really out of control right now.
Wait a minute. So are you saying that there's still day laborers going back and forth?
No, they're returning. So because of the holiday in Israel, Passover, these workers are returning home, and they're coming back. Lots of them are coming back with infections. And the Palestinian government is meeting them at the border, doing tests and trying to identify people who are infected and then obviously taking the proper measures to treat them once they're identified. But that's increased the number of people who are infected over the past week by, I believe, it's doubled that number that we had before, or close to doubled it. So, and these are people that have been tested. Don't forget, tests here are very hard. There's only been about, I think, 7,000 or 8,000 people tested, or 10,000 people tested in the West Bank. And we are also supporting the Ministry of Health to have the proper materials to do more tests here. We've purchased testing materials for them, but it's far short of what's needed to really take control and isolate this infection. Because as you know, what's needed more than anything are testing kits. Because once everybody gets tested, they can be isolated, and then you can really kind of stamp out the virus that way. But if you don't test, then it's very hard to know who's infected and who isn't.
Are these the tests that bring back the quick results? Because I know there's a test here now where you get the results in 2 hours.
There's two types. Yes, we would like the quicker ones, obviously, the ones that can give you the test or the results within a couple hours, and that's what's most needed globally. But in a country like Palestine, obviously, it's where prevention is much, much more important than, because they just aren't going to be able to treat a widespread outbreak. Not that anybody can treat it. We've seen that in New York, we've seen that in Italy, but and in Spain. But here in Palestine, again, the resources are so limited that, and you're trying to treat people under occupation, with all of the impact of and the inability for people to move freely and have access to treatment centers because of the policies and methods of the occupation authority to prevent free movement within the West Bank. All of those factors would make the outbreak here extremely dire and extremely dangerous. So the testing kits are even more important here, because we have to identify and isolate everybody who's infected, lest the outbreak take root and just destroy the health sector and the entire society.
So how soon do they get results? Well, the test kits that they have right now?
Yeah, right now they have the good ones that are giving them back the test in a couple of hours. But there's only a few thousand of those available. And we're getting donations from, particularly from China, and from the Gulf countries are providing funding as well. But again, on a global market, you have to purchase these tests, and don't forget, there's 30% inaccuracies on the when you test negative. So far, 30% of those test results can be false, so false negative. So that's a factor as well that's impacting this treatment process.
And do you expect that there's going to be a complete closure, or Palestinian workers still going to be able to go back and forth to go to work?
I mean, that depends on Israel, and it depends on the Palestinian Authority.
But right now,
I think Israel is taking steps to try to further close their society and close their economy and kind of bite the bullet for the next couple of weeks. So I probably don't foresee any workers going back to Israel in the immediate future until the situation changes. I would say the month of April is a time where both the West Bank and Israel are going to go through some very significant quarantine measures of their populations and try to get this thing under control. I don't think that any other policy makes sense at this time. It's really just playing with fire.
All right. Well, I really appreciate your time, Steve. You've been doing absolutely incredible work with PCRF, with your team over all of these years. I always say you're the guy that gets stuff done. And I always encourage people, if they want to donate, go to pcrf.net and donate there, because the money's going to the right place. So thank you again for all of your time and your efforts, and for all the information. And good luck. Stay healthy. Give our best to everybody in the West Bank, everybody you see. And again, it's pcrf.net, and we'll put a link in so people can go straight to the website. Anything else kind of in closing that you'd like to add before we go?
Thank you, Miko. Well, first of all, thank you for having me, and thank you for all your listeners who are supporting you and the great work that you're doing, sharing information and bringing this message of solidarity, love, and freedom for the Palestinian people. The only message I have is, just don't panic, folks. These are crisis periods that we have to get through together, and don't lose your humanity and don't lose your compassion for others. And this will pass, but it will pass if we unify and stick together and show solidarity for each other as brothers and sisters and take this on together. And that's, I guess, the message we all should be sharing right now. So thank you, Miko, for having me. I really appreciate it.
Amen. Thanks a lot, Steve. We'll talk to you soon.
Yeah, thanks, brother. Take care.
All right, that'll do it. Thanks to everybody for tuning in and educating yourselves on the situation unfolding in Palestine right now. Please get the word out about PCRF's COVID-19 Humanitarian Response Fund. Your tax-deductible donation will help Steve Zorg provide humanitarian support to people at risk, as well as provide medical supplies and equipment during this crisis. All you got to do is go to pcrf.net to donate, or you can just click the description link that I've put below in the description of the podcast. Lastly, if you could please help spread the word of the Miko Peled podcast. We're on iTunes, Stitcher, Google, I think pretty much any podcast app that you use. And if you haven't already, please leave us a rating and review. It helps other people learn about the podcast. If you have any questions for Miko, you can shoot those over to me at booking@mikopeled.com, and we can try to get those answered on forthcoming episodes. All right, till next time.